Why are we afraid of surgery?
मतलब मुझे जो anesthesia मिलेगा उसके बाद में, am I coming back? Am I saying bye to everybody?
If I can treat a patient like I treat my father, my daughter, my son, my brother or my sister,
OT तक पहुंचने तक they are very anxious. How do we reduce their anxiety and what can they do to reduce their anxiety?
particularly it's more difficult if there is no detailed information of that surgery that was done. Aesthetic surgery is challenging in a different way. The problem is when you're dealing with people's mind.
Hi everyone, welcome back. आज हम एक बहुत ही इंटरेस्टिंग टॉपिक के बारे में डिस्कस करेंगे. हम सर्जरी से क्यों डरते हैं? दिस इज़ अ वेरी ऑफन आस्क्ड क्वेश्चन कि सर्जरी में क्या होगा, सर्जरी का नाम सुन के डरने लगते हैं. सो डॉक्टर संजय, टुडे वी हैव यू हियर. आई वांट टू टॉक अबाउट why are people so afraid of surgeries? वो सर्जरी का नाम सुनते ही ऐसे ना थर कांपने वाली जो फीलिंग होती है कि खड़क सिंह तो आया नहीं, सर्जरी आई और वो रैटल कर रहे हैं.
It's not only fear of surgery but any treatment.
Right.
I'll tell you interesting. When I started my practice in the beginning,
Yes.
I used to actually lie down on the table to see how it feels. Just lying down on the table is a different feeling. Forget about surgery, forget about doing anything.
Yes.
So it's a different psychology, and I do totally understand that everybody gets a bit panicked about it. Why are we afraid of surgery?
हाँ.
एक factor होता है pain. Okay. So
Yes.
people feel that it may cause them pain and discomfort.
Isn't there a word for this? I
It's called
believe.
algophobia, fear of severe pain.
Wow.
But it also about fear of something bad happening.
Right.
Something dangerous happening, something happening to their life,
Right.
and
हाँ.
fear of uncertainty.
Very
What
true.
would be the outcome of that is also a fear that people have. So these are the reasons why people are worried about going in for any procedure or any surgery.
But isn't that a lot from not knowing? तो उस हिसाब से लॉजिक वुड डिक्टेट कि अगर मुझे जो चीज़ नहीं पता है मैं जाऊँ and I read more about it. Wouldn't that knowledge give me then the confidence of being able to walk confidently in an OT room?
See, that's true. I mean, knowing is probably a good way, but
Ji.
knowing is also not a good way sometimes. Because when they go and research in the Google or in the
Yes.
internet, they get all sorts of information that makes them more
Have
panicky,
Yes.
that they get more stressed.
They will develop tomophobia if they didn't have one.
Tomophobia.
Yes.
That's the word as well. I think it's the correct information. And more than correct information, it's the rapport with the doctor that is extremely important. So my job as a doctor is look into few things. One, that I should cause minimum pain or discomfort to the patient.
Right.
What do I do to
Yeah.
minimize that is something that I need to worry about and think about constantly. That will help reduce that pain and make them more comfortable, number one.
Yeah.
Number two, to make sure that nothing goes wrong with them. That's my responsibility.
Very
I have
true.
to make sure I take
100%.
every possible care at every step to
Yes.
make sure nothing goes wrong.
Very
And the third thing is to predict the outcome. What outcome I would be able to give to my patient and convey realistically to the patient. I think if these three things are controlled, it will take away a lot of fear factor from people.
So not only do you have featherlight touch, you are also somebody that they can trust implicitly in, like how most of us do for our BFFs. You're also someone who can look into the future and give them a realistic idea of what their future will turn out. So part astrologer.
Have you done skydiving or bungee jumping?
I've always wanted to, but I've never.
It's the same feeling. It's a lot of apprehension, uncertainty,
Right.
what's going to happen. But then you always have a pillion rider with you who actually takes you and jumps from the flight, and you give all your confidence to that person.
Right.
And that person's job is to make sure that it is very secured
Right.
and they have a safe landing. Same
that
thing
makes
applies to a
sense.
doctor or a surgeon.
But then why is it that so many patients or so many people who are even thinking about surgery end up going to multiple different doctors. Don't they trust doctors?
I think that is a factor now. Unfortunately, people have very less trust. See, the medical science is not an exact science where 2 plus 2 is 4. In some situation, 2 plus 2 can be 1. And it may become 4 or 5.
Right.
That's the problem with science. So what we have to do is, obviously, we have to try and do as much control as possible. So that's to reduce the variability. But to give the trust factor to people, one need to be very honest and transparent with the communication. One needs to be very empathetic. And I always say, if I can treat a patient like I treat my father, my daughter, my son, my brother or my sister, then I'm probably the right person to treat the patient. Because I will have the same amount of care that I give my family to the patient, same amount of empathy that I can lend to my patients.
So that actually brings me to a very, very interesting question. Then would you do any of the surgeries, any of the aesthetic surgeries for your own family members?
Absolutely. I am trained and skilled enough.
Have you done?
I have done many. The first surgery I remember I did for my dad when I was a surgeon.
Oh my God.
I treated him and I was a very young surgeon at that time.
Right.
And my father just gave me that responsibility on operating on him.
Oh my God.
So that was my first interaction. True feel of what a surgeon goes through when they operate on somebody who you love.
Yeah.
Then I operated on my mom.
Oh my God.
And then aesthetic surgeries I've done on my wife, I've done on my son, on my daughter, my sister-in-law. So yes, I don't mind operating.
It's definitely lovely to have you as a family member. You've got aesthetics redefined in your family. So when a patient is having so much of hesitation कि मैंने जो भी सर्जरी के बारे में सुना है और मैं करने के बारे में सोच रहा हूँ या सोच रही हूँ, how would you recommend that they make themselves slightly less anxious? Just before a surgery, अगर उन्होंने decide भी कर लिया तो भी OT तक पहुँचने तक they are very anxious. So how do we reduce their anxiety and what can they do to reduce their anxiety?
See, I think the most important thing is to develop that trust factor towards your doctor and a surgeon. That is very, very important. Once you have that bonding with the surgeon or the doctor, you just relax and meditate and think positively.
Right.
Not to think about each and every step of the surgery, what the surgeon will do, or what is going to happen in the post-surgery time.
Right.
But just to relax. So meditation is extremely important, and I think one must resort to that.
Right.
Deep breathing, relaxing, and forgetting that they are undergoing the surgery. Often what happens is it's constantly in their mind, and then they end up talking to Google doctor. And then that's where the apprehension, the fear, all of that increases. I would say shut down your computer, listen to nice music, meditate and relax.
But for those who can't do Vipassana, don't we generally also give them some anti-anxiety medications to just help take that edge off a little bit?
So that's often done just a day before.
Okay.
We give them medication so they can have a good night's sleep. Something like reduces the anxiousness or gives them a good sleep. That does help. But mostly we tell them to prepare a few weeks in advance by not medication, by just natural organic way.
One of the reasons, wouldn't you agree, Dr. Sanjay, that the reason why people are struggling with trusting their doctors is not only transparency about their work, it's also transparency about their qualification. Like there are a lot of people who are doing aesthetic procedures out there in the world who are not surgeons. How do you approach a patient who's had a procedure that is done? They come with even more apprehension, क्योंकि कहीं गए थे, कुछ हो गया उनके साथ, अब वो आए हैं, they want to correct it, but they're also afraid कि अब मैं वापस से जाऊँगा, तो अब क्या होगा? How do you approach such patients?
One thing is now everybody must understand that there is something called as specialized doctors.
Right.
For everything there is a specialized doctor.
Right.
For eye there is a specialist doctor. For nose there is a specialist doctor. For ears there is specialist doctor. For heart there is specialist doctor. Similarly, for cosmetic surgery there is a specialist plastic surgeon.
Right.
A doctor are trained and specialized in that. That's number one. Number two, if somebody has done it, you know, then obviously I don't want them to regret and, you know, have that burden of thinking that they have done something extremely wrong. I would empathize with them. Obviously, they didn't have enough information, or they were lured away to do surgery with XYZ who's not qualified or trained enough. I would still be empathetic towards them and try to correct the problem that they have from then on. So it's important not to, it's like raising your child. You don't want the child to feel, you know, guilty of what mistakes they have done. You just want to positively tell them what you can do to avoid such mistakes in future.
But do you find it more difficult to correct such kind of, you know, the famous word that is used is botched up procedures?
Any botched up procedures or any complications or issues always has challenge. It's always difficult, you know, to correct. And particularly it's more difficult if there is no detailed information of that surgery that was done. And that's another important thing. A qualified plastic surgeon will note down step by step what is done.
Very
So
true.
if, let's say, anything goes wrong and that ends up with another plastic surgeon anywhere in the world, if they have that notes, that will really communicate with them and it will make it easy for them to correct it.
Right.
But sometimes unqualified or quacks, when they do, there's nothing available because even they don't know what they have done. So there's no documentation of that, and that makes it difficult.
I think the reason why they call quacks is when they're talking to each other, you won't understand what it is that they have done. So it sounds just like that. No, you're right. I mean, documentation is 100% important, not only for the surgeon, even for the patient. They should also know उनके साथ क्या हो रहा है. A lot of the hesitation, I believe, goes away when a patient is explained उनको क्या चाहिए, हम क्या करने वाले हैं, वो procedure से क्या gain करेंगे, and we, you know, walk them through all of these steps and try and understand कौन से वो step में अटक रहे हैं. सिर्फ 4 लाइनें बताया कि अच्छा तुम्हें liposuction करना है without explaining क्या होगा क्या नहीं होगा, that itself I believe will cause a lot of anxiety कि I don't know what I'm signing up for and I'm expected to take this leap of faith with someone and I have no idea कि मतलब मुझे जो anesthesia मिलेगा उसके बाद में, you know, am I coming back, am I saying bye to everybody? So I mean, do you get a lot of patients like this, Dr. Sanjay, who?
Yeah, absolutely. I mean, there is apprehension. They're always worried about, you know, and I tell them it's very important that you come back because I need to come back with you as well.
True. Right. No, I was just saying you don't want to be Thanos who's just doing this and suddenly the patients are vanishing. Nobody wants that. But a lot of patients have started developing this habit of, you know, window shopping. कि इस सर्जन के पास गए, ये 4 बात पूछी, फिर किसी और के पास गए, 4 और बात पूछी. But in the end, they're still confused. They still don't know what decision to make. So now, they have, you know, gone to different avenues to try and get information. Then why are they still so scared? And you know, what can we do to help these kind of people?
How to answer that question? I hate people who bargain.
Okay.
I hate people who do window shopping, particularly in medical science. I mean, come on, this is a common sense. You are getting your body treated. You would want to go to the best person, you know,
100%.
most qualified person. It's not buying a shirt that you can चलो आज ये पहन लेते हैं, कल इसको फेंक देंगे, दूसरा पहन देंगे. You know, so I do think that people now need to be smart enough.
I mean, you're absolutely right. You wouldn't bargain with a cardiologist, but you would want to bargain with a plastic surgeon who's dealing with, you know, with your skin and other organs. And for all of you out there, skin is the largest organ of the body. So don't ignore it. So does that affect your ability to give a good outcome to the patient? Does that affect your ability to help someone?
So, you know, when you really want to work on somebody's budget, there are a lot of compromises you have to do. You have to cut on corners.
Right.
I mean, you have to use cheaper material. Sometimes it's possible. Yes, controlling the cost is our responsibility as well.
Right.
So we have to do that, you know, consciously. But then compromising to an extent where it could endanger a person is something that I wouldn't accept.
But I mean, unless you know what are the possible things that can go wrong in a surgery, when you're talking about cutting corners, people still think कि इसमें तो बैठ ही जाएगा, ये तो कर ही लेंगे, ये ज़्यादा बता रहे हैं. And then there is this sort of idea or image कि, you know, ज़रूरत से ज़्यादा जो है प्रोसीजर के प्राइसेस हो रहे हैं या फिर थिंग्स आर साउंडिंग कॉम्प्लिकेटेड बट इट्स नॉट. सो फॉर पीपल हु थिंक प्लास्टिक सर्जरी इज अ वेरी सिंपल थिंग टू लर्न, what do you say to that? I mean, any surgical field is a skill based surgery, but is normal plastic surgery or reconstructive plastic surgery different from aesthetic plastic surgery, and is there a larger skill learning curve involved?
It's the same. Reconstructive surgery, in fact, is much more difficult because it's a complex problem where we are trying to make somebody look and at least do something normal. It's very challenging. Aesthetic surgery is challenging in a different way. The reason is you're working with people's mind, and that's extremely challenging.
Right.
The aesthetic surgeries or treatments are very simple. They are the simplest surgeries. But the experience is required on dealing with those people who are looking for those changes. And that's where skills and expertise are required. Technically, it's very easy. Do it liposuction or tummy tuck or blepharoplasty, very easy. Much easier than reconstructing an arm or reconstructing a full face.
That is true.
But the problem is when you're dealing with people's mind.
I suppose, I mean, when we're dealing with a person's mind, जब जैसे ही OT में जाते हैं, so OT stands for Operation Theatre. There was a time when it was called theatre because you've got a room full of people who are watching it like you would, जैसे Gladiator movie के अंदर जो है आपका amphitheater के अंदर people are watching what's happening inside.
So now it's called OR, which is operating room. It's not theatre anymore.
So I think वो जो concept है जिसके अंदर you're lying on the bed and there are at least 2 to 3 people in the OT. So just the idea that you'll be under and you don't have control over what is happening. Losing control could also be one of the reasons why people feel so scared of undergoing procedures.
I mean, it's same like flying in the plane. Do you fly the plane, or do you go and tell the pilot how to fly? No, you just, because you cannot. You go and sit there.
Right.
So yeah, maybe some people are scared of that. Some people are not scared of that. But you should know that there is somebody expert.
Right.
Who is flying, and not just that. There's a whole system that has been built around to make sure that you fly safe and you land safely. Same thing happens in an operating room. There's a whole system that is involved.
Dr. Sanjay, in today's social media world, there are multiple people who claim to be experts. For someone who wants to decide that I want to go ahead with this doctor who is an expert, how do they know if that person is who they claim to be? How do they know that that person is actually an expert or not? How do they face this fear? This is an impossible fear to face.
So yeah, there's a tick list. Which is there in Google, and you can check with ChatGPT as well, which means the qualification.
Right.
What kind of qualification they had,
right.
How many number of years of training they had,
right.
And what has been their experience and background. And that's now easily available for people to see. If it is not available online, they could actually ask the doctors to show them. But many doctors, they display their certificates. So one should be able to identify what to look for when they're looking for certificates, because certificates can be anything written by anybody, isn't it? So you need to know also the validity of the certificates. I know it's a difficult task. I know it's very, very difficult. But I think it's a need of the hour that one needs to know about that so they can choose better.
I mean, in a world where Gucci and Chanel are having copycats.
Absolutely, and you can identify a difference between a real Gucci versus a copycat.
Yes. I mean, it shouldn't be that hard to figure out a real doctor versus somebody who's just claiming to be one. If I were to ask you one thing that they could do to help themselves get over that hesitation, what would it be that you would say to them? Because there are a lot of people who do require surgery that is going to give them the results that they want. But the minute I so much as, utter the word surgery, there is like, suddenly they are Gandhis, na suno, na dekho, na bolo wala. So what can you say to them, or what should, one say to them to help them get over that intense fear or tomophobia?
I think I would say trust us. Trust the doctors.
Yes, that is true. You have to take a leap of faith somewhere. Might as well start. Thank you, Dr. Sanjay. This has been absolutely lovely. You guys, if you liked it, make sure to like, share, and subscribe, and I will see you soon.